Hi, Dr. Celine. Thank you for coming to the All Pulp No Fiction Dental Podcast. How was your trip to Japan?
Well, firstly, it's an honor to be here. Thanks for having me. It's been incredible being in Japan. Honestly, it's been a bucket list dream of mine for a very long time.
Is this your first visit?
Yeah, this is my first visit to Japan, and for years I've actually had slides in my presentations to do with Japanese wording and culture, even pre-working with GC. So to be here is kind of coming full circle. Really, it's a special place.
How's the jet lag? Come on.
It's awful. But it's worth it. I think I'm Philadelphia's minus 14 hours or something, so I'm still in yesterday. So if anything, I'm time traveling right now, which is pretty cool.
Yeah. One of the wonders of traveling, like you get to come back in time and travel to the future.
You get to miss days and game days.
Game days, right? Yeah. I have a little bit of a small biography about you over here. I copy-paste this from the rap.
Right.
Page. So, you graduated from King's College and you practiced in the UK and then moved to the US, I think very recently.
Yes.
Can you talk to us a little bit about what got you into dentistry in the first place? Like, why did you become a dentist?
It's a good question. I actually did, I started off studying architecture. So I did a 3-year architecture degree. And I love historical architecture, hence Japan being on the bucket list. And but I didn't really realize that I wouldn't particularly enjoy creating it. So I got 3 years into the degree and thought, right, this isn't for me. And I was looking at medicine, and then it was actually my father and a family friend who were like, you love medicine, you love biology, you love people, and you're artistic. Why don't you do dentistry?
And it combines all of these, actually.
Yeah,
right?
Well, exactly. And I mean, at the time, I thought he was crazy because I'd never had a filling before. So I was like, Dad, dentistry is really boring. Why would you suggest that?
You never had a feeling up until college?
No, I know, very lucky. So then
dentists
found this path, which by some miracle, because it was the right path, I think.
I see. And I've prepared a few questions over here, and after coming to Japan, you've spent a few days, and I think you just had a hands-on course. Are there any differences between dentistry that you found in the UK and the US and Japan, at least the dental community speaking?
I mean, it goes without saying. It depends who's listening, really. But it really struck me the quality of the participants yesterday, and the attention that they gave us as presenters and each other and the translators, the respect. The love for their work. I'm not saying that UK and American dentists don't have that same love, but there's a certain current running through Japanese dentists, which I think is integral to Japanese society, which is really quite mind-blowing. So actually quite intimidating to present because, the standard is so high. So I was really blown away yesterday. It was incredible.
I mean, from the comments I saw on social media, everyone was just so impressed with the presentation. So,
which is nice to know. I think that's all Bohr is doing. But
I mean, I'm pretty sure your hands-on was. Everyone was very impressed.
Yeah.
I could feel that from the vibe that I saw from everyone's faces. Can I also, like, talking about social media?
Yeah.
I saw you posted something on social media, and it's not about dentistry actually.
No. Oh, rare.
Yeah. You said life is not all about dentistry.
No.
And you were talking about
Motorbikes.
Yeah.
Yes.
So
yeah. I know.
When did you start?
I know. Well, I kind of came out the womb with a love for motorbikes. I don't know why. It's in my blood. It's in my DNA. And actually, my bike of my dreams as a child was the Yamaha R1, which is a Japanese bike.
But you own a Ducati, though.
I have Ducatis now. I went to the dark side.
Why
My
did
sincere
you-
apologies
why
to
did-
my Japanese audience right now. Ducatis are just very pretty.
I mean, they are. They are.
So yes, I have 2 Ducatis. I have one for the track, one for just running around, and I love them. And the track biking, it's people think I'm crazy when I say this, but it's like meditation. You're so focused. It's like dentistry when you enter a flow state.
You need to focus.
Yeah.
Like, your attention cannot
It blocks
be
everything out.
Yeah.
And so it's similar. It's a similar feeling to skiing or racing a motorbike, or when you get stuck in a dental procedure and you're just lost in it and you forget your name, you forget the time, you forget the year. It's amazing.
How did having these hobbies affect your professional life? Like, how do you balance them, or how do you use them to get better at your job basically?
Very good question, and I would probably change it and say, how does my professional life affect these hobbies? Because at the moment, the hobbies are probably non-existent. This is where I sound like a fraud. There's me saying, there's more to life than teeth. But the last year, especially, I think because of the move to the US, it's been just crazy. But it's not easy to balance all of this. I have a friend and colleague in the US who's from New York, and he always says, I'm too blessed to be stressed. And I think that's really accurate. So if I'm honest, the hobbies haven't shown their faces much this year. So I need to find a way to balance that a bit more, because it's important. I think when your work is as intense as it is for us, again, blessed, I feel very lucky with where I am. But I don't know, they allow you to have some fun and realize that there is more to life than teeth, I guess. So you can refresh a bit.
Okay, but I think we need to go back to teeth.
Yes, we do. We do need to go back to teeth.
Yeah. So about trends in dentistry recently, like adhesive dentistry has been evolving quite. I wouldn't say rapidly, because it's evolving in a very good pace, I would say, and it changed the way we do dentistry, generally speaking. How do you feel adhesive dentistry have affected the dental world and made dentistry more mature? I don't know if mature is the word, but
I'd say evolve is a good word. And actually, it kind of brings me back to motorbikes in a way. You'd have a driving license to drive a car and a driving license to drive a motorbike, and they're two entirely different things, but it's still a driving license. And I think adhesive dentistry versus mechanically retentive dentistry is the same analogy. They're both dentistry, but they're just completely different. They're two completely different disciplines now. I think the evolution has been so intense that it's now a different species. I think we're working in a time where we can really do best by our patients. We can really give them what they need and deserve, and we can come as close as possible to kind of replicating nature, repairing nature, if you like. But it's hard. It's difficult to do this kind of dentistry. So I think it's a blessing. I feel so lucky to be working in this day and age. But it's not easy to do, so we need to respect it.
Why is it not easy to do?
I guess what
are the checkpoints that needs to be?
It's very step intensive. So, for example, if you're placing a filling, restoration, a direct restoration, with mechanically retentive dentistry, which I'm not saying is easy, it's very, very difficult for different reasons, but there were fewer steps. You cut your cavity, you make sure it's got an undercut, you remove your caries, you place your amalgam, you carve it, you let it set. That's pretty much it. And I don't mean to simplify this type of dentistry. Like I said, it can be very complicated. But if you're then doing a simple restoration with a composite, then immediately there's at least 4 times more steps. There's rubber dam isolation, there's your cavity preparation, then you're beveling your enamel, you're using a fine grit diamond, you're using your caries removal, you're air abrading, selective etching or total etching, you're using prime, you're air drying, you're bonding, you're light curing, you're putting in another layer of composite. So suddenly all of these steps are there and they matter. If you miss out certain steps, the quality of your restoration drops each time. And I think the standard across the world really is actually a substandard for adhesive dentistry. That's why white fillings don't last as long as metal fillings, according to most dentists.
So if we take all these proper steps, do you think white fillings are going to be the same as...
Yeah.
So
the evidence supports that. When they're done correctly, they'll last decades. But unfortunately, so many of these steps are missed. I mean, rubber dam isolation, one of the most fundamental steps, is missed by 80% of dentists.
I don't know how many dentists use rubber dam, to be honest.
Easily less than half, potentially less than a quarter. And there was a study recently published, actually, saying that the use of rubber dam, by not using a rubber dam, the bond strength to enamel drops by half just because of the humidity in the mouth, which is pretty intense if you think about it. Very significant if you think that adhesive dentistry is all about the bond strength. That's the most important part. That's the crux. Yeah. So, and that's where, adhesive dentistry, I wouldn't say
that's
difficult.
Cutting it by half.
Yeah. And that's just from the humidity. That's not even from saliva. So if you think about dentists who aren't using rubber dam and who maybe aren't using air abrasion, who aren't using the primer properly on the dentine, all of these different things, which is pretty standard, then your composite restoration that could be lasting 20, 30 years might well last 5 years.
That was a pretty interesting point of information.
Fun fact.
Very fun facts.
Yeah.
Very shocking for everyone.
And it was a highly respected study as well. It wasn't just one that we
better, better check that study. I'll try to link it below if you could.
Yes, absolutely. I can give it to you. Yeah.
And talking about the different steps, I think I prepared a few questions about that. Isolation and using a rubber dam obviously is one of the crucial, apparently, with this especially kind of information. But if you would, other than isolation, if you would pick another stage or another step that is you would pick as the most crucial also, second most crucial, what would it be?
The interaction between the primer and the dentine. So the formation of the hybrid layer on the dentine. So the dentine bond, I think often I say it's crucial because I think a lot of people miss it. People will just place the primer and air dry it. That's it. You need to scrub it in for about 20 seconds. The dentine's got these tubules. It's like a sponge. And we're relying on this molecule to go down into the tubules and form a connection and a tag. And if that step isn't carried out correctly, which a lot of the time it isn't, then you just don't get that bond to dentine. So that interaction there is probably the most crucial for most restorations.
I was watching your podcast on another podcast interview, and you talked about shrinkage, composite shrinkage, and how to avoid it. Can you also give us a little bit of points on how to avoid composite shrinkage and make sure to minimize it and to actually get that bond to the dentine to be as effective as possible?
Yeah, so that's, I mean, there's many ways. There's correct material choice, light curing, etc. But one of the most, I guess, relevant ways, or it's really a buzzword these days, is IDS, immediate dentine sealing, where it's not necessarily combating shrinkage, but it's allowing the bond to dentine to slightly develop with time. It gets stronger. So when that bond is initially made, when the bond is light cured, let's say it's at a strength of, I'm just going to use an arbitrary unit, it's a strength of 5. After 5 minutes, it might be at a strength of 30. And if you layer...
by leaving it?
Just by leaving it with time, it kind of cooks, it ferments, if you like. So
you don't, after you apply the primer, you don't... cure and then add the flowable composite?
No, well, you do a bit of flowable. So you do your primer first, you air dry it, you add your bond on top, you cure it, and then you do a very thin layer of flowable, cure it and leave it. And what I would do is at this point, I'm leaving that, and then that's when I do my matrixing. So I place my matrix, etc., which can take a few minutes. And by allowing that time, we've then allowed that dentine bond to get a bit stronger. So then when you place composite on top, which naturally every composite will shrink no matter how good it is, even if it's GC. No matter how good it is, every composite will shrink. So it will shrink slightly, and it shrinks away from the weakest bond. So if that bond has been allowed time to develop, then it won't shrink away from there, and it won't break that dentine bond at the bottom of the cavity.
I'm sorry, it might be a stupid question, but when we're adding the flowable composite, it wouldn't have the same effect.
Because it's such a thin layer, you do 0.5 millimeter. The C factor is very low, so the ratio of bonded to unbonded walls is so high that it's negligible.
Okay.
So it's never going to shrink up in that direction.
It's not like when you're adding a bulk fill composite or something that is just gonna.
But even if you were layering in a millimeter thick layer of kind of paste composite, it may well still pull up from that dentine bond, especially the deeper the cavity, the wider the dentine tubules, the wetter the area, the harder it is to bond to. Therefore, the more chance there is of there being gap formation at the base of the cavity. So the more important it is to do this process, really.
We're talking about bonding to dentine already. Shade matching also. In order to get not just form factor, but shade matching between the restoration and adjacent teeth, what are the most crucial steps that you follow to make sure that works out?
Great question. Well, I mean, it depends on the anterior and the posterior. For posteriors, really, Everex Flow Dentine, one of the many reasons I love it is the perfect dentine shade. It is an A3 shade. It's dentine, and it's got similar translucency, everything. So my go-tos for posteriors, unless the tooth is black or unless the tooth is completely, anomalous, is the Everex Flow Dentine for dentine, and then I'll use an enamel shade, AE Accord or something for the enamel. And that's kind of my slam dunk for posteriors. Obviously for anteriors, shade matching, one of the most important things. Firstly, do it before you put the rubber dam on. Don't let the teeth dehydrate. Take photographs. Take polarized photograph take fluorescence photographs, take all the photographs you need to take to analyze the shade fully, not just with your eyes. There are obviously different materials out there you can use. You can use a system like eLab, which uses kind of photo spectrometry or whatever. But for me, the most important step is take it before you place your rubber dam on, take the photos you need, including cross-polarized especially, and go from there. I mean, there's different shade tab systems as well. There's one that focuses on value first. So value, hue, chroma. The standard Vita classic shade guide.
Yeah.
I'm not saying it's useless, sorry Vita, but the way it's arranged, it's arranged by hue. It's arranged in A, B, C, D.
Yeah.
And actually the most important factor when you're shade matching is value. It's how bright or dark the tooth is. So immediately anyone who's got a Vita classic shade guide, reorganize it. You can Google it. Just, organize a Vita classic shade guide, organized by value, and reorganize it by value. And then you can check better.
Actually, I was interviewing Dr. Javier Tapia over here on the same same podcast.
Yeah. Oh God. Well, okay. Listen to what he says then.
No, it's very very similar content, very simple things.
Yeah.
The concept of shade matching is have changed quite a lot since the Vita shade have been made, and this is why we have the other materials also that does a little bit better job doing that. But when again direct. We're not talking about direct dentistry. And do you have a preference to work with direct or indirect approach, or and I know everyone says it's a case by case thing. I know. But as a preference though, if there is a case and you would
love it. I said it like that.
Which one would you prefer to work with?
Honestly, I think that the artist in me loves direct dentistry. I love, like I said earlier at the start of the podcast, I love getting into that flow of whether it's anterior composite or posterior composite. And with posteriors, there's that argument people say, are you doing it for you? Are you doing it for the patient? But if you can reproduce the correct anatomy beautifully and quickly, then you're doing it for both of you, which, if you're taking 3 hours to do occlusal anatomy, then maybe you need to check yourself before you wreck yourself. But so when it comes to direct, sorry, it's very English expression.
That was nice.
When it comes to direct, I love getting into that flow. Having said that, the satisfaction you get, whether it's posterior, anterior, indirect work, when you're fitting veneers or fitting onlays, and the margin is chef's kiss, and it plops on, and you almost can't see the margin because it's all gone to plan, and it's all gone, and the lab work's beautiful, and the collaboration between patient, dentist, assistant, lab work, the whole team, that's also very satisfying.
When it works well, right?
Yes. Whereas for indirect, I find if indirect doesn't work well, for years I struggled to find a lab that I worked well with in the UK, and then I got really in sync with this one lab tech who I still use now, and it was wonderful. We had this great collaboration, so that was wonderful. But for a while, if things weren't quite going right or something, I kind of always had this anxiety before the fit appointment as to whether it was going to work or not. Whereas with direct, the more I do, the better you get, and the more I trust myself. And
you just control the whole process.
And I'm a total control freak. So, if it comes to it, one day I'll probably end up like Javi. I mean, hopefully like Javi, but, making my own indirects, because there's times, I'll never be as good as a lab ceramist, but I do love the control and the preparation you can have with a direct case. You've got it all in your head, and there are fewer variables to control there, which gives me a bit less grey hair. Yeah. True fact.
If you would give a demerit for the direct technique, what would you call it? What would it be?
A demerit, as in a bad thing about it, about direct.
About direct.
Oh gosh, nothing.
Time consuming, maybe.
Time consuming, yes, but you can get pretty quick with it.
The better you get, the faster you become.
Yeah, definitely. And I think with the materials, again, I'm not meaning to plug EverX Flow, but it is one of the best dentine replacements because it suddenly makes that step so much faster. Previously, we're layering in these tiny little increments, and you're left doing a composite for 3 hours. So you can do it quickly. I think there is nothing better than indirect for reproducing anatomy. No matter how good you are at direct, there's nothing better. But also, if you look at the mindset of trying to copy nature or letting nature be your guide, if you look at the physical properties of the tooth, if you look at the physical properties of dentine and the physical properties of enamel, Composites more like dentine, especially some fiber reinforced composites. They're more flexy, they've got similar modulus of elasticity, etc. Whereas certain porcelains are more like enamel. So lithium disilicates, for example, even some feldspar, they are more similar to enamel. So if we can find that perfect blend of restoring the dentine of the tooth with something like a composite and then restoring the enamel of the tooth with something like a porcelain, so it's a blend of direct and indirect, I guess, then we're getting closer to that kind of, that perfect goal. So I'd say that's where the shortfall of direct is. If you go fully direct, you're losing that advantage of the porcelain to restore that part of the tooth.
I know you're a strong believer, and my English went away.
Which is bad.
If you're a strong believer in minimal invasive dentistry, right?
Yeah.
And do you think direct or indirect is more in line with minimal invasive dentistry?
Gosh, I mean, again, it totally depends on the case. I mean, it's such an annoying answer, but you can do... indirects can be placed with almost no prep. So can directs. I guess indirect is longer lasting. It is, just by the nature of the material, the wear resistance of porcelain versus composite, So minimally invasive dentistry, it doesn't necessarily mean how much you cut the tooth. Minimally invasive dentistry is how much treatment is done to that tooth in its lifetime and how long can that tooth be kept in the mouth. So, for example, on a posterior tooth, if you do a minimally invasive direct composite, that may last decades, but if you do a minimally invasive indirect porcelain, that might last a lifetime, just from the nature of the material. So whichever one slows down the restorative cycle of the tooth is the most minimally invasive. And often, I think any dentist would say this, a well-done indirect, most good dentists would say if they ever needed anterior work, they'd want to get well-done porcelain veneers rather than well-done composite, because by the nature of the material it wears, it chips more. True. So if I had to answer, I'd say indirect would be the most minimally invasive, but it's a tough one. As long as they're both done well, they're both incredibly minimally invasive. If they're both done poorly, they're incredibly invasive. So
makes sense. We're closing with two questions.
Okay.
First is any advice that you would give to young dentists who are striving to become excellent dentists, excellent practitioners? My English keeps flying away today. I don't know why.
It's okay. We can do this in Japanese. I've been learning.
Any advice?
Firstly, mindset. I always talk about be the best that you can be. Just try not to listen to that voice on your shoulder that's telling you something's good enough. Even if you're rushed, even if you've got patients waiting, just really try and dig deep and find that extra gear to find a solution. Secondly, invest in good materials and equipment. Never, ever let your materials and equipment be your defining step as to how good you are. You're only as good as what you use. You may be the most talented tennis player in the world, but if you're playing with a wooden racket, you're not going to do very well. And dentistry is the same. So invest in good materials and equipment and focus on things that aren't dentistry first, like photography. Get good at taking photos of your work. Get good at rubber dam. I'm biased, but these two things, they're not dental treatments, but they make your dentistry so much better. Get good at photography. Get good at rubber dam. Wear loops. Your loops makes your dentistry better in the moment. Your photography makes your dentistry better after the fact when you can review it. So all of those things, and then start to look at the dentistry you want to get good at.
I see. Thank you very much for this.
That was a long answer. Sorry.
No, but that was a great answer actually. Photography, especially, I'm a big fan of photography, and I think that's. Most of very talented dentists that I interview always focus on photography because that's how you evaluate your own work. That's how you get better, right?
Takes a snapshot in time.
Yeah. Last question is, we are having the 6th International Symposium.
Oh, really? No, I'm joking.
That's a secret. Not so much a secret.
Yeah.
So if you have a word for the participants that want to apply for the symposium, what would you tell them?
I'd say just it's a no-brainer. It's a complete no-brainer. The quality of the speakers, myself excluded, are really it's really a super high level. Having now been to Japan and visited GC, it's a company like no other.
Thank you for wearing the green shirt.
The GC green
color, yes.
But it's a company like no other. It's a country like no other, and it's a lineup like no other. The quality will be amazing, but the philosophy will be too. So if you're considering going, then don't consider anymore. Just go. Just come.
Thank you very much, Doctor. Appreciate you.
Thank you. It's been a pleasure.
Thank you.
Time flies when you're having fun.
Guess so. Yeah. Thank you. I'm glad you're having fun.
Yeah.
Okay. Thank you, guys.
Thank you.